Good morning. After the first two videos where we have seen how an HPLC is done and how it works, what are the main issues that you may encounter while using it, what are some solutions to these problems? Today, I want to talk about Metformin, since it's a widely used drug for the treatment of type 2 diabetes mellitus, and that in 2016, 422 million people were affected by this disease. Here's what is said by the EMA. Metformin may increase the risk of a rare but serious complication called lactic acidosis, which occurs when naturally produced lactic acid builds up in blood faster than it can be removed. Currently, the product information states that metformin must not be used in patients with a reduced kidney function, because these patients are considered to be at a higher risk of developing lactic acidosis, as their kidneys do not remove metformin efficiently enough. Additionally, a recent clinical study conducted by Pavia Antiviral Center doctors in 2014 has shown that acidosis lactic associated with the metformin accumulation may occur, doses lower than the recommended daily maximum dose of 3,000 mg. After the late onset of therapy with patients without prior contraindications for metformin therapy, as a result, my colleagues started highlighting that metformin pharmacological monitoring should become a good clinical practice during treatment with this molecule, just to prevent the onset on side effects that I have just reported. These are the reasons that have led us to produce a kit for quantification of metformin in serum, using an HPLC with a UV detector. We are convinced that this kit will be useful for proper pharmacological monitoring in patients in therapy to support the activities of specialist doctors, such as diabetologists, endocrinologists, and general practitioners. Poison patients to support emergency medical activities with the possibility of differential diagnosis and/or periodic checks. What we need for this analysis: isocratic HPLC equipped with a UV detector, ready-to-use kit complete with lyophilized calibrator, lyophilic controls, pipette and micropipette to variable volume 100 to 1000 microliters, tips, plastic tubes, reduced volume vials with caps, counter centrifuge, vortex, sera. We take as an example a session of analysis of 7 serum samples on which metformin dosage should be made. Along with these samples, we also analyze one well-known lyophilic calibrator, and we will use it to automatically build on the software the calibration curve and 2 lyophilic controls to check the validity of the calibration curve, and therefore of the entire analytical session. First, we prepare the HPLC. The instrument must be cleaned from the previous analysis. We put the HPLC grade water into the pump and let it flow into the system so that the tubing is flushed. This is important because the column mustn't come into contact with the organic solvents. Washing the needle is also done with water and not with organic solvents. After being primed with water, we can continue by inserting the mobile phase, reagent M, into the pump spout, mounting the column and flushing at 1.2 ml per minute for 30 minutes. Let's go to the workbench and reconstitute the calibrator and the lyophilic controls. Let's take the filters included in the kit and let's go for the analytical session. I suggest you name them on the bottom or on the filter collecting cone. Remove the cap from each filter and add 300 microliters of sample, lyophilic control or lyophilic calibrator, We close the filters with the cap. Now centrifuge all filters at 3500 RPM for 30 minutes. Once the centrifugation phase has been completed, remove the Sierra filtered from the filtering collecting cone and transfer them into the suitable vials for the autosampler. The filtered Sierra will also be clear, although the sample of origin are lymphemic or hemoglemic. The column in the meantime will be conditioned, so after moving to the instrument and preparing the job list, inject 2 microliters into the HPLC. This is a typical chromatogram for this analysis. The chromatographic runtime is about 7 minutes, which means that we will have all results of our 7 samples after slightly more than 1 hour from the first injection. And it's very important to note for the laboratories as far as the timing is concerned. The time we took for this analysis is as follows: 30 minutes to prepare the test and the analytical system, 5 minutes for the sample dispensing into the filters, 30 minutes for centrifugation, about 70 minutes to analyze all the samples. In these conditions, you are able to report by 12 o'clock each day and use your instrument and your work to perform other analysis. Currently, the Eureka kit I have presented to you is an Eureka exclusive, available for metformin dosing in HPLC. Let's summarize. In this video we have spoken of metformin, its side effects, and the need to measure its concentration in serum. Shown how to perform metformin analysis in HPLC using the Eureka kit. Highlighted the speed of the analysis. Shortly, I will send you a flyer on metformin where these concepts are explained. And do not miss the next videos. I'm going to talk about the analytical chromatographic technique that has been spreading in clinical laboratories. That is liquid mass spectrometry. Bye for now.